Xtalks is the industry leader in connecting life science, food, healthcare, and medical device professionals. The Xtalks Life Science podcast features insightful conversations with industry experts about all things pharma, biotech, and more.
Hello and welcome to the Xtalks Life Science Podcast. I'm Vera, editor-in-chief at Xtalks.com, and this week I'm delighted to introduce a very special guest on the show. We have with us today Dr. Alessandra Maleddu, sarcoma specialist at the University of Colorado. Dr. Maleddu is a medical oncologist specializing in sarcoma. She treats patients with soft tissue and bone sarcomas and has a special interest in desmoid tumors and clinical trials. Now, desmoid tumors are rare and locally invasive soft tissue tumors. They are often misdiagnosed as they differ from person to person. And notably, women are 2 to 3 times more likely to be diagnosed with a desmoid tumor than men. Dr. Maleddu completed her training in Italy and the UK with a sarcoma fellowship at the University College London Hospital, general oncology training at the University of Bologna, and an MD from the University of Cagliari in Italy. Now, to learn more about the work Dr. Maleddu is helping lead in the sarcoma space with the focus on desmoid tumors, let's turn to her now. Thank you so much, Dr. Maleddu, for being on the show today.
Thank you, Vera. Thank you for having me here today, and thank you for giving space to this very important topic.
Great. Thank you so much. I was wondering if we can start with your background in medical oncology and what brought about your specific interest in desmoid tumors.
Okay, perfect. Thank you. So, as you said, I'm gonna start from my interest in sarcoma. So, I went through my medical oncology training in Bologna, and that was around 2008 around 2008, and those were the early years of new discoveries. New drugs were coming around for the treatment of some sarcoma, and it seemed very exciting. So I started getting really interested in sarcoma from there, and then it wasn't up until my most recent fellowship in London where I started seeing patients with desmoid. I worked with an attending that had a dedicated desmoid clinic, and as a fellow, I started helping her, and I found this group of patients especially fascinating. So when I moved here in Colorado to the US, I decided that I really wanted to keep following these patients.
Yeah, and so could you tell us more about desmoid tumors and who do they most frequently impact?
So desmoid tumor, as you said in your introductions, are very rare mesenchymal tumors. So they come from a particular tissue in your body, which is called connective tissue. They are locally aggressive. They have the particular feature of not being able to travel to other districts of the body. And this is really important. But being locally aggressive, they can really impact patients' quality of life. And when you put this together with the very particular population of patients that they affect, you understand why they're very relevant. In fact, the most common patient is normally a female on between the age of 30 and 40 years old. And if we look at the incidence of desmoid, we know that we have about 1,000 or 1,600 desmoids every year in the US. The age of diagnosis varies from most commonly 20 to 45 years, but as I said, 30 to 40, and then female patients are more commonly affected, 2 to 3 times more commonly affected than men.
Yeah, so I wanted to ask you some follow-up questions. So you mentioned that they occur in connective tissue of the body. So which areas of the body would that be in? Sorry for not knowing. And so where are desmoid tumors commonly found? Which areas of the body would that
So
be?
this is a great question because, like all tumors of the connective tissue, they can arise anywhere in the body. That's what makes them so challenging. There are very many aspects that are unpredictable about desmoid, and the area of origin of the tumor is one of those. So they can come from the limbs and the trunk and the chest, the neck, but they can also arise from intra-abdominally, and that's where they get a little bit more challenging to manage, and they really need specialized input.
Is there any area of the body where they're most commonly found out of those?
I would say probably the chest and the limbs are more commonly found, just because of, you know, just broader areas. But yeah, you can find desmoid anywhere in the body because the connective tissue is anywhere in the body. It's basically the tissue that has the job to keep all your organs together, right? It supports your body.
Oh, and so is this a rare type of tumor?
Yes, it's really rare. It's a really rare type of tumor. That's also why it's challenging because when you think about doctors in the community, in their lifetime and in their career, they may see just a couple of desmoids, and because the management is continuously evolving and we always come up with better ways to manage them, it's hard to be up to date if you only see a couple of those in your career.
Yeah. And you also mentioned that, and we know that women are 2 to 3 times more likely to be diagnosed with a desmoid tumor. Um, do we know the science behind why women it happens more in women than men?
So that is correct. So women are 2 to 3 times more commonly affected than men. There are several clinical observations that say that possibly the hormonal environment has an impact. In fact, desmoid are also commonly found following a pregnancy, and that's an observation that has come from several groups over the past few decades.
So we were saying that they are often misunderstood. And why do you think that is? And why do they often go misdiagnosed?
So desmoid tumors are often misdiagnosed, and it's very common. About if you look at the literature data, about 30% of patients can be misdiagnosed at the beginning, and there are a couple of reasons. One, it's because they really can mimic other tumors, right? They can mimic lipomas, or they can mimic more aggressive form of tumors like GIST and leiomyosarcoma, both on imaging, but also under the microscope. So sometimes the diagnosis is challenging even after a biopsy. That's why it's really important for patients to be reviewed at a sarcoma center.
Okay, I see. And could you share, while we're on the topic of diagnosis, could you share what biomarkers or diagnostic tools are currently being used or are in development to better identify and monitor desmoid tumors?
For sure. So I'm gonna explain the ideal path to diagnosis for me. What is it? So if you have a patient that presents with a new lump or a bump or something that's growing, the best thing to do always is to get imaging, right? Ultrasound, it's fairly easy, and that's the a great first step. MRI is even better. So if you can do an MRI after that, that only reveals the presence of the tumor. What is diagnostic is actually a biopsy. So a biopsy is a simple procedure, um, fairly simple procedure, where a small piece of the tissue is taken, then brought to the lab and looked under the microscope. Under the microscope, your pathologist, which is the doctor that has the expertise to tell you what is actually the process, can describe the features and in general just proceed with some um, stainings. So the beta catenin staining is a very, very important for desmoid. You see the accumulation of the beta catenin protein in the nucleus of the cells. And in general, that's sufficient for diagnosis. In case of equivocal staining, that's where more sophisticated testing come into play. For example, molecular analysis. So you really look at the genome of the tumor, and you can find that a beta catenin mutation is really common in about 85 to 90% of desmoids. And in the lack of a beta catenin mutation, then you look for an APC mutation, which through a different mechanism, through a different mutation, can cause the growth of a desmoid as well.
Yeah, I see. And so that really covered like the diagnosis of the tumor, but I was wondering currently what are the unmet medical needs for this tumor when it comes
Yeah,
to like treatment?
there are several unmet medical needs. I mean, the way we manage this tumor, I have to say, has improved immensely over the past decades. For example, surgery has been surpassed. We don't regard surgery anymore as the first approach, which is really good because we do know that looking back at all data, about 50% of patients they used to undergo surgery, then they experienced disease recurrence. So that's for sure important. We do know that many patients can actually, after they're diagnosed, don't need treatment. So a wait and a surveillance, it's called active surveillance. An active surveillance approach is now recognized as universally accepted for certain patients when the symptoms in the clinic allow it. For those patients that present with symptomatic disease or deformity or decreased range of motion, we now have active drugs, but I would say we still need more research. We still need better biomarker to understand which one are the patients that can actually safely be surveilled, which one are the patients that have a more aggressive form of desmoids and they need treatment. So those are unmet needs because it's a very heterogeneous disease and we still don't completely understand the natural history of it.
I see. So that was why it's challenging to treat and why it's been difficult to develop effective treatment options for desmoid tumors.
Yes, exactly. It's very heterogeneous. So if you see your patients in clinic, some of them have very mild and some many times asymptomatic disease, and other patients they come to clinic and they have very aggressive disease with lot of symptoms, deformity, decreased range of motion. So these are all factors that significantly impact the quality of life. And then other factor that makes treatment and management of these patients very challenging is that those are young patients, so they are in a very important moments of their life. Many of them are they have young families, or they have they're in a moment where they are trying to give everything to a career or a life project, and the desmoid sometimes many times is getting in the way of that.
And you mentioned that some patients they have like asymptomatic. They are asymptomatic. Could you explain like what do you mean? Like what would be the difference between asymptomatic patient and someone that has a lot of symptoms for this particular disease?
For sure. So some patients have they come across they're diagnosed with desmoids because they have, let's just say, a tumor growth in one of their limbs, for instance. And many times these desmoids can have, stable, small size, don't cause deformity. Maybe they're far away from a joint. Um, maybe they're stable. So in general, tumor that is not growing doesn't tend to be very painful. So especially if it's not growing, if it's not a very big tumor and is not near joint or vital structures, those are the ones that can be observed in clinic. They don't need very aggressive treatment. And we do know that a number of desmoid can also undergo spontaneous regression. So those are your best candidate for surveillance. Then there are other patients that come to clinic and they are in pain. Their desmoid may be near joint, so they come with decreased range of motion. Um, they have pain. They are really difficult to treat with common painkillers. And this is due most commonly to tumor growth. And if you think about how desmoid growth, they have this ability to grow through the fascial planes of the muscles. So we can understand how painful that is. So those are your patients where you really have to think about treatment.
Yeah. And I know that you have a special interest in clinical trials for desmoid tumors. And so, with your experience there, could you tell us what role have patient advocacy groups played in advancing research and in encouraging trial participation in the desmoid tumor community?
So the role is huge because especially for rare tumor, you understand that patient advocacy is everything from getting to the right doctor. Because, as I said, if you think about the United States, it's a huge country. We only have 1,000 or 1,600 desmoids per year. So you understand how difficult it is to find a doctor that has experience. So patient associations are really important to create a network on between doctors and patients. I receive referrals constantly from patient associations, and that's important because many of these patients they need treatment, or when I have a clinical trial, I can offer to them. Um, Patient associations are also really important because they create they can create a special space for education. They also bring clinicians together, so it is really important when clinicians with interest in desmoid tumor get together and share ideas, and then we can really plan for the next clinical trial for these patients.
Yeah, and so given the rarity of the disease, in your opinion, what are some of the biggest challenges in designing and enrolling patients in desmoid tumor clinical trials?
So the biggest challenges are certainly recruiting patients, because when you have rare diseases, the accrual is always, it's always crucial, because this is a rare disease. And as I said, not all patients need treatment. So that makes it even harder to recruit. You really want to treat only the patients that have a clinical need. But I think that when we work together, when us clinicians work together and we also work with patient association, recruitment is feasible. Of course, if you try to do a clinical trial as a single center, that's always going to be challenging.
Yeah. And in the time that you've focused on desmoid tumors, in your opinion, how has the awareness of desmoid tumors evolved in the medical community, and what do you think still needs to be done to improve recognition and diagnosis?
So I think awareness has raised and has been wonderful, and way more people come to clinic now compared to a few years ago, and they're well informed about their disease because they have had the chance to talk to a patient association first, which is something I didn't used to see. Let's just say even just 5 years ago, right? But so that's really relevant. But what can be still done is keep going, keep spreading the word, because I think one of the most challenging aspect that I gather from my patients of having a desmoid is not just finding a doctor, it's also the feeling of isolation. So until they find their patient association, they it's rare. They almost don't know. They normally don't know anyone else that has a desmoid. Um, Unless we are talking about the minority of patients that have a familiar syndrome. But most patients feel really isolated. What can we do to improve the outcomes of our patients? That was the second part of your questions. I think it's really important to have every patient with a suspect desmoid to be seen at the specialized medical center that has experience in sarcoma, because only this way we can really make sure they're getting the right treatment, they're not receiving unnecessary surgical procedure, um, and they can really be screened for the most effective treatment if they need one.
Yeah. And to wrap up, I wanted to ask you, do you anticipate any advancements in the field in the coming years of desmoid tumor care, treatment, diagnosis?
So yes, I mean there are a few studies. As I said, we don't use sequencing in clinical routine. We do molecular testing. In my institution, we every patient receives molecular testing, but there are a few studies on new molecules. There are a few studies that are looking at sequencing, perhaps to understand which one are the patients that have a more aggressive form of desmoids versus more indolent. So I think the next few years are going to be really rich of pleasant surprises, like the past few years have been.
Great. Well, thank you very much, Dr. Maleddu, for being on the show today. I really appreciate your time for this insightful discussion.
Thank you, Vera, for having me.
Great. And that's the end of this week's episode of the Xtalks Life Science Podcast. If you liked today's show, please don't forget to rate, review, and subscribe. Thank you, and we'll see you next week. Bye.
To join the Xtalks community, visit xtalks.com and register for exclusive access to curated content like live webinars, news articles, and educational videos. The views and opinions expressed in this podcast are those of the speakers sharing them and should not be taken as professional advice, nor do they necessarily reflect the policy or position of Honeycomb Worldwide. For further information, email us at podcast@xtalks.com.